Have you ever wondered how doctors see inside of the body without surgery? Have you ever wondered why pregnant women get so many scans? Today, I will be explaining ultrasound in a very simple term, what ultrasound really is, why it is done, why it is safe, and why it is one of the most important diagnostic tools in medicine. My name is Chinaza. I am a medical sonographer, and my goal on this channel is to explain ultrasound in simple and easy to understand terms beyond all the technical jargons you hear from your doctor or your sonographer. And if that sounds like something you are interested in, feel free to hit the subscribe button, like this video, turn on post notifications so that you don't miss out on any video I will be dropping on this channel. So what is ultrasound? Ultrasound is basically an imaging modality that makes use of sound waves. Ultrasound, sound waves. Now, I'm not going to go into the physics of ultrasound. Like I said, simple and straight to the point. Think of it like this. The machine sends sound waves into your body bounces back those sound waves, and the machine creates images of the body using those sound waves that was echoed back. Easy peasy, lemon squeezy. There are different parts of the machine that is responsible for doing this. But like I said, I'm not going to go into any complex physics of ultrasound. But just so you know, ultrasound basically uses sound waves to create pictures of internal structures of your body. Anybody can get an ultrasound. There are different types of ultrasound. We have the pregnancy scan, which is the most popular one. It is also called obstetric scan. So sometimes you might hear your doctor asks you to do obstetric scan. He or she is basically referring to pregnancy scan. That scan is used to see or monitor the fetus inside the womb. You may also hear your doctor tell you to do an abdominal or pelvic scan. That's basically to see organs of the body, the liver, the kidney, the spleen, the gallbladder, the uterus, the urinary bladder. Note, the urinary bladder is different from the gallbladder. Medical students will understand me better. But those are all organs of the body. We have the cardiac scan, which is used for the heart. We have the Doppler scan, which is basically for blood flow. We have small part scans. We have scrotal scan. We have breast scan. We have thyroid scan. The only organ of the body or organs of the body that are not usually visualized on scan is basically the brain and the bones. That is where ultrasound is limited. So ultrasound doesn't see the bones. You can't also use ultrasound to visualize the brain. But basically other organs of the body within the abdominal region can be visualized using ultrasound. Let's talk about the safety of ultrasound. Ultrasound is generally safe when handled by a professional. There are no risks involved, which is why it is often the modality of choice for pregnant women, because the baby in the womb is safe. Any adult undergoing ultrasound is also safe. There is no radiation risks, and the sound waves that are used, even though they are inaudible to the human ears, that means you can't hear these sounds, but they are completely safe and they pose no threat or no harm to whoever is undergoing ultrasound procedure. So why ultrasound? Why ultrasound? Anybody who has undergone any procedure in the radiology department will agree with me that ultrasound is one of the easiest, fastest, and less complex procedure. It is an outpatient procedure. That means you come in the same day and you leave almost immediately. There are no special preparations. The duration is not long. It is not complex. The report doesn't take so much time. And it is very, very simple and straightforward compared to other imaging modalities we have in the radiology department. So it is most times the test of choice or the procedure of choice for diagnostic medicine. So that is ultrasound 101 for you. That is the simplified approach or simplified explanation on how ultrasound works, the various types of scan, why it is done, and how safe it is. In subsequent videos, I'm going to be breaking down these different types of scans. I'm also going to be answering some of the questions you have in mind that you did not have the time to ask your doctor, or maybe your doctor or your sonographer explained, but you just didn't get it. So I'm going to be answering a lot of ultrasound questions. On this channel, it is everything ultrasound. If that's something you're interested in, feel free to join me. Click the subscribe button, turn on post notification so you don't miss out on anything. And if you also have questions or confusions you would like me to address, feel free to drop it in the comment section and I might just make a video on it. You never can tell. I'll see you in my next video. Bye.